Hi, my name is Sebastian Cotofana. I'm a professor of anatomy based in the United States, and the topic of this lecture is going to summarize the processes of aging that happens in the face. To do so, it is important to first understand what structures do we have in a face. I mean, what type of tissue do we have in a face? And the tissues that can be found in the face are actually starting from the bone. Then we have ligaments, then we have fat, we have fascias, we have muscles, and then of course we have the envelope, which is called the skin. So all of these structures that are present in the face, all of them can age.
Something below the skin, so it gives us a certain degree of three-dimensionality. The layers need to be connected to the bone. This happens with ligaments. But here comes the thing. These ligaments are thought, and all of them are actually osteocutaneous ligaments. So that means they connect bone to skin. Fat is a part of this superficial fascial system, and you can imagine when the fat is properly in volume, like indicated here between the difference between grapes and raisins. When the fat compartments are like grapes, fully nicely shaped, full of volume, then the force transmission from the muscle through the retinacular cutis, through the fascia to the normal undersurface is much better. It's much more direct because there's no loose movement that is not transmitted to the skin surface. Just imagine a muscle can contract and can twitch, but if there's enough loose connective tissue between them, this movement is not being transmitted to the overlying skin. On the contrary, the skin can also move, cause wrinkles, follow the effects of gravity because it's not directly connected to the underlying unit made of muscles and connective tissue. Frontalis muscle is always thought to be a two-dimensional structure. Frontalis muscle has no connection to the bone unless you consider the muscle that's located in the forehead as the anterior belly of the occipitofrontalis muscle. And then you know that the occipitofrontalis muscle has an attachment to the posterior nuchal line. But frontalis muscle itself, only this portion, has no connection to the bone. It glides freely on the bone. And this is why this muscle needs to be suspended by fascia. In this dissection, you can see that on top of frontalis muscle, I left a little bit of fascia attached. It might look like an inaccurate dissection. However, if you look at this slide, which shows an ultrasound image of the forehead and the respective frontalis muscle, you can see that you have many more layers. In this minimal soft tissue thickness, that's somewhere between 3 and 7 millimeters, we have 9 different layers. And these layers indicate something very special. The frontalis muscle has a fascial coverage on its surface, which is called suprafrontalis fascia. And the frontalis muscle has a fascia on its undersurface, which is called subfrontalis fascia. So these two fascias form a sleeping bag around frontalis muscle. And if this is understood, it's understood that the frontalis muscle can do only one thing, can approach the head portion of the sleeping bag to the leg portion of the sleeping bag, bringing those two ends together.
So we know that skin firmness and skin elasticity reduces. But what also happens is the signal when measured from the frontalis muscle, which means by electromyography, reduces. In a recent study that investigated facial aging, it was shown that the frontalis muscle in their sample that they investigated reduces in signal, but failed to reach statistical significance. In a recent study, however, in a much larger sample size, it was shown that this reduction reaches statistical significant level, which means the muscle or action potential, or also called the motor unit action potential of the frontalis muscle, reduces at high age. Which is interesting because it seems that truly, especially in the forehead, the frontalis muscle is affected by aging. But what does it mean? The skin becomes firmer, the muscle becomes weaker, but what happens to the mobility? Interestingly enough, the mobility of the forehead increases when we use three-dimensional skin vector analysis. And the reason is why it increases mobility, it's because the amplitude of its mobility is increasing. Why does the amplitude increase? Well, because all of the soft tissues descend. Calvarial volume loss, fatty deflation theory, all of this results that gravity pulls the soft tissues more downwards. And if then the frontalis muscle contracts, of course the amplitude is larger because there is more room to move the soft tissues. And this is why when using skin vector displacement analysis, we have increased mobility at high age. We know this. When we look at older people, how they move their glabella or how they move the forehead, we are surprised how much mobility is there. And the reason is because there's just a different baseline from where to start from. So if we understand that this is the arrangement of the muscles which overlie the bone, and that the muscles have to be seen as a unit with connective tissue and with the skin. So these three items have to be seen together. It's not only the muscle as a simple muscle tissue. No, it's muscle, fascia, and the skin. These are an important unit. These three have to be seen as a unit. Now, if energy, for instance, is applied to the so-called sleeping bag affecting the connective tissue, it shrinks. This results in the fact that the muscle is not so stretched within its sleeping bag. And when the muscle is not so stretched and doesn't have to work so much, we have less wrinkles. So it means we help the muscle to relax by reducing or applying energy to the sleeping bag. So this is kind of how we can explain that by the application of energy, skin surface improves, wrinkles improves, and the overall appearance of the forehead looks much younger. And this is only possible if we understand that the frontal soft tissues undergo a certain process of aging, if we decode that process of aging, but if we understand that there is a unit between muscle, connective tissue, and skin. And only when understanding this unit together, then we can understand age-related changes, and then we can combine them into treatments. And this is also holding true for the midface and also for the lower face.
Another example is the midface. In the midface, there is a fascia that's attached to a muscle. Nothing special, but from the muscle to the fascia, then the fascia attaches to the maxilla, so to the bone. So there's a connection between muscle and bone, and this connection is called the transverse facial septum. This transverse facial septum forms the inferior boundary of the midfacial fat compartments. And when we smile, we contract zygomaticus major muscle, and when we contract the muscle, we tense the fascia, and this pushes the midfacial fat compartments upwards. Very similar to like a loose hammock, and suddenly you strengthen and increase the tension of the hammock. So everything that's located inside the hammock is being pushed upwards. Best example, apple cheeks. Sudden increased volume upon smiling. Smiling, contraction of zygomaticus major, conformational change of the transverse facial septum, and this allows us exactly to change the position of the midfacial fat compartment. Here you can see again another very great example of how muscles are integrated into a fascial system. Zygomaticus major and zygomaticus minor. They're all interacting with the SMAS. They're connecting all of these structures together. And this is why we have coordinated movements. And this is why in the face, we never have a single muscle facial expression. Every facial expression is a multi-muscle movement. This is why muscles acting together as a unit, right? So let's talk a little bit about muscle aging, especially facial muscle aging. A couple of years ago, we did a study in which we used electromyography. So it means electromyography, not by puncturing the skin, but just by clipping something on a skin surface. And then we looked through all of the muscles, and we found out that when all of the muscles are being summarized, there was no difference between young and old individuals in terms of their signal-to-noise ratio overall and in their signal overall. But I did not stop there. I said, I don't believe this. There has to be a difference. Well, and then I looked at each individual muscle. And at each individual muscle, I looked at the signal. The signal is kind of the strength of the muscle activity. And I found out within the study that there's only one who has a statistically significant decrease in its signal, and that's zygomaticus major muscle. We know that zygomaticus major muscle connects into the SMAS. And we know that this muscle at higher age seems, based on the results of this study from the investigated study population, reduces its signal. And if this is the case, we can understand why at higher age the midface is dropping, because the muscle is not strong enough to keep its position within this mass, and then gravity does its effect and everything moves downwards, right? And this is kind of indicated here by these results. But what is more important, what I really would like you to take away from this lecture, is muscles cannot be seen as a single unit. Muscles need to be seen in conjunct with connective tissue, the superficial fascial system, the superficial and deep fat compartments, and the dermal undersurface. All of this needs to be understood, and in a treatment plan, all of this needs to be targeted, because this is exactly the point how we should see the face, how we should integrate facial biomechanics, because this is how anatomy is. It provides us with updates, right? With this, I would like to thank you very much for your attention, and I'm hoping to seeing you soon in the future in person.